Oh, maayong adlaw na tanan. If you had a stroke and you still don't have good movements, no smooth movements on your affected side, you need to use a mirror to trick your brain on how to move it again. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. Now, mirror therapy is mostly used by patients who had a stroke, where one side is affected and you have difficulty moving that side. It is also used by patients with traumatic brain injury or even with patients who had an amputation. This is used by watching or observing the good or functioning side in motion or moving as reflected by a mirror. So by doing this, you'll be made more aware of the affected side. So the good side is moving, but by observing the mirror or their reflection, your brain will not be able to distinguish whether that is the good side moving or your affected side. So it will trick your brain that way. So there are various tests that are showing good results. In fact, in those tests, the affected side will light up even if you're just observing the reflection on the mirror. Now, this is done for many weeks, like maybe 1 or 2 weeks, and for a few hours, 2 to 4 hours if you can do it. You can also just spread it out throughout the day. Now, you have to be consistent in order for this to work, all right? But you should have some sort of movement already on your affected side. You should have some sort of strength there too. So in order for this to work, there has to be a little bit movement on that affected side. Now, if you are ready, let's get started and do the mirror therapy. So when we do mirror therapy, we need to do natural movements that we need during our self-care or our daily tasks, like raising up our arms or going diagonal, things that we need to do or movements that we need to do during our daily tasks. Like, say for example, you're going to put on your shirt, you have to raise your arm up, right? Or when you're brushing your teeth, you have to go diagonally when you go this way, right? So we need to do those natural movements, all right? So all you need to have doing the mirror therapy, you don't have to buy those special equipments when you are at home, especially when you are doing your therapy at home. All you need to have is a long mirror. See? It's a long mirror. You can get this at any grocery store or Walmart, and this is not very expensive. It's like maybe less than $10, okay? So put it between your legs, all right? And your mirror should be facing towards your good side where you are able to move it. Make sure that this is propped up and you're not able to see the affected side, all right? Also, when you are moving, try to really look at the reflection. Look at your reflection and focus on it, okay? So first, we're going to raise our arms up. Try to do this multiple times, but for this video, we're just going to do 10 repetitions, okay? So again, we're going to first do raising up our arms, all right? So just like this. Now look at the mirror and observe your good hand, all right? So you're going up and down. This will trick your brain that the affected side is also moving, okay? So up and down like this, 10 times. 3, 4, 5, 6, 7, 8, 9, 10. All right? Now let's try to do the elbow bending. So elbow bending like this. You need this when you are going to feed yourself. All right? So this way. Let's do 10 repetitions again, okay? So observe and pay attention to the reflection. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Right. Next, we're going to do diagonal movements. So we need this when we are going to put on our shirt or to brush our hair. Okay? Diagonal patterns are the most common patterns or movements that you do when you are doing your self-care. So diagonal patterns, all right? So it combines raising your arm up and elbow bend, okay? So this way and come back out and back in, all right? And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. Next movements, we need the table. I'll show you how to set it up. Okay, so this is how you set it up on a table, okay? So all you need to have are books or things that you can prop up the mirror in that orientation or in a vertical orientation, okay? So you have the books, right? And then you put the mirror in between those books and prop it up like that, okay? You might need help in setting this up because again, you had a stroke and your other side is affected and you have difficulty moving it, all right? So once you have set it up, then you're ready. This is it. You don't have to buy those expensive mirror box, especially if you're just doing your therapy at home. Okay, so the first exercise on the tabletop is going to be table tapping. Again, pay attention on your reflection. Don't look anywhere else. Just look at your hand and your reflection. Your affected side will be resting on the other side of the table, other side of the mirror, okay? And so you're going to just tap, tap 10 times. On your own, try to do it more than a minute. The longer, the better, okay? So let's do 10 taps just for this video. Like I said, on your own, do it more than a minute. Okay, so tap 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right? Next one, you go opening and closing your hand. Open and close. We need this movement in order for us to hold and release an object that we need during self-care. All right, so opening and closing your hand. Just keep on paying attention on the reflection. This will trick your brain, all right? Let's do 10, opening and closing your hand again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Next one will be just waving. So the wrist is just going to, the fingers are pointing up, they're pointing down. So just like you're waving, okay? So 10 times again, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? Next, we're going to just touch the mirror like this. Just touching the mirror. Again, 10 times. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right? You can do whatever kind of movement you want, okay? If you have a cup, try to flip a cup, all right? You know what? Let me get a cup. All right, so I found a cup. All right, you see it? I know it's clear, it's hard to see, but what we want to do, again, natural movements, just look at the reflection, try to pick up that cup and bring it to your mouth, like that, okay? Bring it to your mouth, put it down on the table. Let's do 10, again on your own, do it for a minute or so. More than a minute is better, okay? So let's go bring the cup to your mouth and put it back down to the table. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right? You can also pick it up and then flip it down. Pick it up again, flip it over. Again, pay attention. Don't look anywhere else, just your reflection. Please don't look at your arm. Don't focus your attention on the moving arm. Just the reflection on the mirror, okay? Pick it up, flip it over. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right? You can do all sorts of stuff with this mirror therapy. All right. So the next one that I'm going to show you, we will be using it to work on our legs. So this time we're going to work our legs. So you put your mirror in between your legs and the mirror is going to face the good side. Okay? So again, this will work to trick our brains that our affected side is the one moving by looking at your reflection. Okay, so the first exercise is going to be picking up your leg like this, up and down. All right, so support the mirror and pay attention to your reflection. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, next one, you're going to kick. You can see your reflection. It might not show. In this video, my foot might be moving over the mirror, but you can still see it using your own mirror, okay? Your reflection. You are able to see your reflection with your leg kicking. All right, let's do 10 again on your own. Do more than a minute. All right, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, now let's go kicking to the side or just stepping to the side. All right, like that. 1, and bring it back to the middle. All right, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then last one for this video is going to be just ankle rocking. All right? Pay attention to your foot this time. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, so those are the exercises you can do with a mirror for your legs. So there you have it. That is mirror therapy when you have stroke or traumatic brain injury and one side is affected, one side is having difficulty moving, but it's already starting to move, but you don't have that good control yet. Okay, this will really trick your brain into thinking or registering that it is your affected side that is moving just by observing the reflection on the mirror. This will really trick you. It even tricked me. Trust me, it tricked me. I thought it was my other side that's moving together with the good side. All right? Now, if you find this video helpful, please click on that subscribe button and give it a thumbs up. And please share this to patients, family members, or friends who had a stroke and is already recovering. All right? There's a little bit of movement on that affected side. So, until next time. Oh, I forgot. Let's exercise our minds and our bodies so we get stronger together. Paalam.